Hey, thank you very much. Subcommittee comes to order. Good afternoon and welcome to our witnesses and audience members. Let me thank you, everyone, for coming and for participating in this subcommittee hearing. Here. This seems to be stuck.
Right here.
I think we're all pretty familiar with this new virtual setting, but because this is our first virtual hearing of this subcommittee, I want to take a moment to provide members with a few reminders before we begin. We will proceed in the same fashion as this committee always has. We will begin with opening statements by the chair and ranking member, followed by testimony from our witnesses and an opportunity for every member to inquire for 5 minutes. We will dispense with our practice of observing the Gibbons rule and instead go in order of seniority for questioning, alternating between minority and majority members. Members are advised that the clerk may mute those who are not speaking in order to limit background noise and feedback. However, all members are responsible for unmuting themselves when they are recognized for their 5 minutes or when they otherwise seek recognition. I want to thank you all for your patience as we navigate this new technology in order to continue serving our country together in this great time of need. With that, I welcome you to the subcommittee's hearing on the child care crisis and the coronavirus pandemic. Evident events of the past weeks have shown the need for policies to strengthen child well-being as thousands of youth all across America marched, demonstrated, and some even looted as they challenged our systems of social, educational, and economic justice. Child care powers both family economic well-being and our national economic growth. Prior to the pandemic, federal funding only provided child care for 1 in 6 eligible children. Parents in communities weighed down by poverty and systemic racism experienced a shortage of high-quality, affordable child care. Today, we face a global pandemic that has disproportionately infected and killed people in these same struggling communities. And the child care crisis we had before it is now much, much worse. Now parents have lost millions of additional child care options, and providers confront new costs to keep children and workers safe, risking financial losses for businesses already operating on the knife's edge of profitability. In Illinois, nearly half of all previously available child care slots are at risk of disappearing altogether due to the pandemic, and 60% of child care programs are fully closed. In Chicago, I must say we did not have much to lose. Pre-pandemic, 5 out of 6 Chicago children lived in a child care desert where children outnumbered child care slots by 3 to 1 or more. As states lift stay-at-home orders and other economic restrictions, more parents are returning to work if they can. Quality, affordable child care is a cornerstone of parents' ability to work and move up the economic ladder. I know essential workers who couldn't work because they had no one to watch their children. I know parents who've lost so much income that they can't afford child care in order to work. As a Black man living in Chicago, I have grieved at far too many funerals for friends lost to COVID-19. And I know far too many parents who legitimately fear for their family's health when they return to work and their children go back to school. When I see the devastation caused by this pandemic and the barriers to working due to child care, I am offended by claims that people will refuse to work because of the availability of supplemental unemployment benefits. This charge is simplistic, insulting, and refuted by data showing that low-wage workers stay at work and return to work, even when faced with unsafe working conditions and inadequate wages. As our nation grapples with structural racism, policymakers need to enact policies that support workers and address the barriers they face, taking care not to penalize communities weighed down by poverty and racism. Big challenges call for big solutions. Now is the time for this committee and this Congress to take meaningful action to ensure that high quality child care is available to all who need it. I look forward to working with Ranking Member Pilarski, the members of our subcommittee, my good friend Bobby Scott, who chairs the Education and Labor Committee, and Chairwoman Nita Loy at the Appropriations Committee, to use all the levers at our disposal to grow our workforce and our economy. We must invest in families and in our child care infrastructure, both the people and the buildings. We need to make sure that parents can afford quality child care, that the people who provide it earn a living wage. That is the right thing for our economy, the right thing for our children, and the right way to give everyone a fair shot in America. Finally, I ask unanimous consent to submit to the record a new report by the University of Illinois system about how child care is foundational for economic recovery. I will now recognize the ranking member, Ms. Pilarski, for an open statement. Representative Pilarski.
Thank you, Chairman Davis. I appreciate you holding this hearing today on child care and the corona crisis. I share your interest in this topic, and I believe child care is key to making America's recovery even stronger. I want to thank all the witnesses for taking the time to join us as well. Millions of Americans want to return to work, and in order to do so, they must be able to rely on child care providers to keep their children safe and healthy throughout the workday. Even before this crisis, we knew there were challenges to ensuring Americans had access to affordable, high-quality child care. The pandemic has only exacerbated those concerns, with the child care industry hit hard by this crisis. Many providers, which largely operate on break-even margins, could remain closed, making it even harder for families to find child care. Republicans and Democrats have consistently worked together to address these issues. In the last 5 years, Congress has doubled funding for the Child Care and Development Block Grant and included billions of dollars in much-needed support to providers and essential workers in the CARES Act. With states safely reopening, child care providers now face many new challenges. These include restrictions on group and class sizes, social distancing guidelines, and other health and safety protocols that are necessary to prevent the spread of COVID-19. These new requirements and ongoing concerns the pandemic presents are making it hard for providers to recover and maintain a thriving business. Yesterday, I had the privilege of talking to 4 child care center directors in my district in Indiana. Child care was deemed an essential service. All the providers I talked to have gone above and beyond to keep their businesses afloat and ensure their children and teachers are in a safe environment. One provider said she spent $20,000 to stock her 2 centers with face masks, cleaning materials, and individual sets of learning materials for children. Another provider needed to put in a new hand washing sink, and another was hiring a cleaning service to take some of the burden off of her own staff. They talked about the need to hire quality teachers so they can have smaller class sizes and consumer education so parents can feel comfortable bringing their kids back. In my district, the manufacturing industry relies heavily on these providers, and it's a battle every day to keep their doors open. Thankfully, these and many other childcare providers in Indiana are receiving extra support through grant awards from Early Learning Indiana as part of its quote unquote Come Back Stronger campaign, which was launched in early May with the support of a $15 million grant from the Lilly Endowment. Since then, Early Indiana was awarded 155 early education providers more than $2 million for health and safety related expenses and hiring teachers. From the beginning of this crisis, Indiana acted to prioritize working families by using funds from the CARES Act to provide rapid response grants directly to child care providers. I have tremendous respect for the state and local leaders who stepped up and worked hard to help families impacted by the pandemic. I'm thrilled to have Dr. Sullivan with us here today to talk about those initiatives. Traditionally, in these discussions, the needs of child care centers take center stage. But I also want to highlight small home-based providers. Many family child care homes played an important role throughout this crisis by remaining open to provide child care for essential workers, particularly those working non-traditional hours. Family child care arrangements are often more affordable and provide flexibility for working parents. Many parents prefer family child care because it offers smaller scale, mixed age care that allows for close and lasting bonds with a caregiver. As we continue to deal with this public health emergency, we should ensure the availability of child care settings that serve small groups of children, which can be a reassuring option for parents concerned about COVID-19 exposure. These family child care providers also have just that small business that our economic recovery will depend on. I hope we can work together to find ways to support and strengthen child care for working families. If a large portion of our nation's providers are forced to permanently shut down, parents in all industries will be unable to go back to work, significantly slowing our own economic recovery. Child care is exactly the type of smart investment we should be prioritizing as we safely reopen and rebuild America's economy. I look forward to our discussion, Mr. Chairman. With that, I yield back.
Thank you, Representative Woloski. Without objection, all members' opening statements will be made a part of the record. And now we turn to our witnesses. Let me thank you to our distinguished witnesses for taking the time to appear before us today to discuss this very important issue. First, I have the honor of welcoming Mr. Rashid Malik, a senior policy analyst at the Center for American Progress, who focus on child care. Next, we have Ms. Regina McChristian, an essential worker at a Chicago area hospital and mother of a 2.5-year-old daughter. Thank you, Ms. McChristian. Dr. Aliyah Samuel, who is Executive Vice President for Government Affairs and Partnership at the Northwest Evaluation Association, and is an expert in race equity and child development. And finally, I will recognize the ranking member, Ms. Woloski, to introduce our fourth witness.
Thank you again, Mr. Chairman. I'm pleased to introduce Dr. Jennifer Sullivan, who has served as the Secretary of the Indiana Family and Social Services Administration since January of 2017. She's also held the positions of Deputy State Health Commissioner and Director for Health Outcomes at the Indiana State Department of Health, and is also a professor of clinical emergency medicine and pediatrics at Indiana University School of Medicine. She's been dedicated to building effective and efficient delivery of healthcare and social services to Hoosiers and is committed to strategic alignment across government and the private sector to improve health outcomes and fill unmet social needs. I think we will benefit from her unique perspective on these challenges. Dr. Sullivan, thank you so much for being here.
Thank you, Representative Wolarski. Thank all of you. Each of your statements will be made a part of the record in its entirety. And I would ask that you summarize your testimony in 5 minutes or less. To help you with that time, please keep an eye on the clock that should be pinned to your screen. I will notify you when your time has expired. And it's my pleasure now to ask Mr. Malik if you would proceed.
Thank you, Chairman Davis, Ranking Member Wolarski, and members of the subcommittee. Thank you for inviting me to testify today. I'm here to discuss our nation's child care infrastructure, which I believe will play a pivotal role in determining whether our country can successfully recover from this unprecedented economic and public health crisis. The U.S. invests a small percent of our GDP, into childcare than almost every other developed economy in the world. Perhaps it should not surprise us then that licensed childcare in this country is often prohibitively expensive and beset by supply shortages that result in long waiting lists and reductions in labor force participation. Over the past few years, my colleagues and I have studied these shortages by constructing the first and only national database of licensed childcare providers. By combining state-level data gathered from public records requests and publicly available databases, our team could identify the location and capacity of more than 235,000 childcare providers, including both home-based childcare and childcare centers. By comparing these childcare locations with the nearby population of young children, we've been able to study what we call childcare deserts, areas where there is not enough nearby licensed childcare to serve the families that may need it. Based on our analysis of childcare supply across every U.S. Census tract, we found that approximately 51% of families with a young child live in a childcare desert. This week, we launched an important update to our website, childcaredeserts.org, which features interactive maps that show at the neighborhood level where these childcare deserts existed prior to the pandemic. After studying these communities, we've come to the following conclusions. Childcare deserts primarily impact low and middle income families. Predominantly Hispanic neighborhoods are very likely to be childcare deserts, and many, but not all, predominantly Black neighborhoods lack sufficient childcare. Also, rural areas have very little licensed childcare and tend to rely more on home-based providers whose numbers have been in decline over the past decade. Finally, it's vitally important to highlight the effects that childcare deserts can have on gender equity in the labor force. The availability of childcare is closely tied to maternal labor force participation. In fact, our polling has found that mothers say access to more reliable and affordable childcare would allow them to take steps to increase their earnings and advance their careers. The signs we're seeing from the industry are worrying. 1/3 of the childcare workforce lost their jobs in April, and those jobs may not come back without a public investment. Revenues have been decimated due to lower enrollment, while operating costs associated with reopening have increased dramatically. Without new federal funds to support the physical infrastructure of childcare facilities, we should expect diminished childcare supply, which could inhibit our economic recovery. And to this point, the Center for American Progress just yesterday published an open letter to policymakers signed by 100 prominent economists who stated that, quote, an effective government response to the childcare crisis will play a vital role in the reopening of workplaces. My sincere concern is that without major immediate and ongoing investments in our childcare infrastructure, we could very well lose as much as half of our country's childcare capacity. Ultimately, we could be left with a childcare system that is only accessible for the privileged, limiting access for children for whom the benefits of childcare are the greatest. We risk economically disastrous outcomes as women take on more and more unpaid childcare duties and put their careers on hold or reduce their hours worked. An immediate influx of dedicated childcare funding is needed to stabilize the industry. But the coronavirus pandemic merely exposed long-standing issues in the childcare market. A long-term investment, such as an increase in mandatory funding for the childcare entitlement to states, would allow states to make much-needed improvements. And moving forward, we need policies that do three things. One, increase compensation and provide professional development for early childhood educators. Two, build the supply of quality childcare options available near home or work that provide care when families need it. And three, reduce costs for families so that all children can access early learning opportunities regardless of their householding. Thank you again for inviting me to this hearing, and I look forward to answering your questions.
Thank you very much, Mr. Malik. And now I'd like to ask Ms. McChristian, who is what I call an essential worker, and they have been so much a part of our effort to navigate the pandemic that we all face. Ms. McChristian, would you proceed? You need to be unmuted.
Okay, can you hear me?
Yes.
Okay, thank you. Good afternoon. I would like to thank you, Chairman Davis, as well as Ranking Member Walorski for holding this important hearing. My name is Regina McChristian, and I am a CT technologist at a hospital just outside of Chicago. I'm also the primary caregiver for my 2.5-year-old daughter. At the start of the pandemic, I was forced between working my full schedule and caring for my child. My employer actually had hours for me to work, but I had to reduce my schedule down to just 1 day per week because of the lack of childcare. Daycare, child facilities were closed for quarantine, as we all know. And that meant that working less to make up the difference. Her father is a UPS driver and is considered essential as well. So for us, it was very frustrating and stressful to have child care facilities closed during the pandemic. The world counts on us, and although we are willing to step up in our roles as essential workers, it just felt like the rug was snatched from underneath our feet, taking away our choices to work. In addition to lack of child care, one of the issues that I face with working as an essential healthcare worker is child safety. I am literally filled with anxiety and fear when I think about my daughter's well-being while trying to focus on performing my job as a technologist in the emergency room. As a frontline healthcare worker, I have witnessed just how ill people are who battle COVID. And as we all learn about this new virus and the damage it can do, it is very important to try to quarantine, as I am an essential worker in a hospital. I'm unable to do so because our parents are the caregivers for my daughter, and they have been a big help. But my mother is only able to help out so much because she lost her own job. Now, however, she is over 60, which means that she's at a greater risk at becoming ill. And this is another thing for me to worry about and balance as I try to care for my child and make an income. Child care centers provide a very safe and sound structural atmosphere that can be very difficult to replicate at home. There is also a very social component that is important for growth and development for my child, which my mother and I cannot replace. Interacting with a group of her own peers will help build confidence and team building skills. There can be some uncontrolled distractions at home that can interrupt learning time. It would be better for my daughter to be in a child care facility than home so that we can develop social skills and have her bond with peers. However, I have major concerns about how daycare facilities can and will adjust to the new guidelines being put into place. I understand that distancing and testing are huge components in helping contain the virus and keeping everyone safer. Does this mean less children in a class? If so, funding is what's needed to make this happen. Our experience across the nation so far has shown that proper testing, PPE, and social distancing significantly reduce the risk of infection. Often children spend more than 8 hours with daily daycare workers, which means that funding for testing is also very critical. I believe that certain safety measures should be put into place before sending my daughter back to daycare, such as more hand washing stations, smaller class size, and spaced out learning stations. Daily testing with rapid results for staff should also be provided, especially for asymptomatic cases. It is quite difficult to socially distance a 2-year-old toddler. So adequate staffing is very important to provide separate entry and exit access points for parents and students, as well as sanitizing the restrooms frequently. Each child should also be accompanied by staff during restroom hand washing time to ensure the proper technique is applied. Before I can even consider going back to work full time, I need an absolute peace of mind that the above mentioned changes take place. Her father is really adamant about paying to maintain a slot for her in daycare, but would like to keep her home for the first 2 weeks if the facility opens as a safety precaution, which is also another strain on our budget to deal with. The COVID-19 crisis has made it harder to care for my daughter and harder to do my job without distraction. Before we can go back to work, we need to make sure that childcare is safe and available for everyone. Thank you very much for your time, and I look forward to any questions you may have.
Dr. Samuel, you might need to unmute.
Okay, I'm here. Can everyone hear me?
Yes.
Fantastic. Good afternoon, everyone. I'd like to express my gratitude to Chairman Davis and Ranking Member Wolarski and members of the Subcommittee on Worker and Family Support at the Committee on Ways and Means. I come to you as a lifelong educator and policy leader with deep subject matter expertise in education, spanning birth through college and career and their connections to life outcomes. However, I am first and foremost a parent who has navigated the obstacle course of childcare with 2 young sons, one with special healthcare needs. As you know, this pandemic has highlighted the inequities that were hidden in plain sight and exacerbated the challenges from access to affordability and the ongoing debate on quality early childhood care. A critical factor prohibiting parents, particularly single parents and women of color, from obtaining and retaining employment is childcare. Rigorous kindergarten state standards have widened the disconnect between preschool learning and expectations at school entry. Daycare is simply not enough to prepare our earliest learners. The neuroscience has made it clear that brain development within the first 5 years after birth is the gateway to lifelong learning, health, and success. Public investments in high-quality childcare will pay off doubly in supporting learning and reducing many of the most common chronic diseases across the lifespan. This brings to bear the importance of expanding our focus beyond just ensuring the safety of our youngest citizens to really building a strong foundation for life. 2/3 of families today have all available parents in the workforce. And as I'm sure many of you can relate, we know that having a safe place allows parents to focus on their jobs and provides peace of mind that their child is being cared for. Access has been an ongoing obstacle as we elevate the need to ensure equitable outcomes for all children, but it has been especially difficult for parents and children of color. Prior to the pandemic, 51% of the country lived in a childcare desert, widening the disparities in early childhood care for communities of color and families facing economic insecurity. 37% of Black babies and 30% of Hispanic and Latinx babies are living in poverty compared to 13% of white babies. Of the 40 million unemployment claims during the pandemic, 21% of those were workers of color in essential jobs. And for families who are already struggling to make ends meet due to the rising costs, are spending approximately 29% of their income on weekly childcare costs, compared to 6% for families at or above the federal poverty level. This means that our children who need early childhood care supports the most are not only unable to access the care they need, but are at increased disadvantage throughout their lifespan. Some childcare centers, which already operated on thin margins, were compelled to close due to lack of attendance because of parents' concerns about their health. A national survey found that nearly half of low-income families are not going to be able to return to prior childcare arrangements post-pandemic, which is crippling to the workforce. Of the childcare facilities that are or will open, they continue to struggle to ensure the health and safety of the caregivers and children due to cost of cleaning products, proper PPE materials, staggering drop-off and pickup times, infrastructure adjustments, and the continuously changing guidelines as we learn more about COVID-19. Children of employed mothers under the age of 3 who are living in poverty spend an average of 21 hours per week in non-parental care. This includes any type of care not taking into account quality. The Child Care Development Block Grant has the potential to directly support working families during tough times like these, so parents can leave their child in a safe place while they work. But safety alone is not enough. Children's developing brains need responsive interactions, language-rich environments, and supportive trained teachers. Especially now, as high-quality programs suffer financially, parents in a bind may not have access to these programs. As I mentioned in my opening statement, I am a mother of a child with special healthcare needs. My son was a patient of over half a dozen specialists across 3 states by the age of 3. The combination of his amazing early childhood care providers and healthcare professionals provided him an opportunity to thrive in the learning environment and me the opportunity to have the career that allows me to support my family and advocate for so many families like mine. In my current and previous roles, I've worked closely with governors' offices on a variety of issues, which included childcare topics. And I've seen firsthand that early childhood education is not a partisan issue. It is clear to me from both my professional and personal experiences that our children and citizens' health and prosperity cannot be a partisan issue if we are to achieve equity and opportunity, excellence in outcomes, and ultimately ensure the success of the workforce and long-term viability of our economy. In closing, ladies and gentlemen of this esteemed committee, I implore you to continue to increase your investment in the childcare industry and its infrastructure. This will help to support the health and safety of our workforce who are highly dependent on access to childcare and early learning opportunities for their children. As I previously outlined in the Child Care is Essential Act, a $50 billion commitment to the Child Care Development Block Grant provides families direct access to child care and support and to providers on the front lines. Additionally, an increase in guaranteed federal funds through the Child Care Entitlement to States will help states budget, plan for, and invest in widely available high-quality child care, which will steady the needs of the current workforce. Our states are requesting and desperately needing this support to revitalize their economy and send parents back to work and children back to environments that will keep them healthy and safe.
Thank you, Dr. Samuel. Thank you, Dr. Samuel. And now I'd like to ask Secretary Sullivan if you would proceed.
Chairman Davis, Ranking Member Walorski, and members of the subcommittee, good afternoon. My name is Dr. Jennifer Sullivan. I serve as the Secretary of the Family and Social Services Administration, Indiana's Health and Human Services Agency under the leadership of Governor Eric Holcomb. I'm also a practicing pediatric emergency physician at Riley Hospital for Children. High-quality, affordable childcare is a key component of achieving well-being for our kids and opportunity for their parents, and that is even more true during our comprehensive response to COVID-19. From the outset of Indiana's response, we define childcare in our guidance as essential, meaning that the operations of childcare are necessary to continue to support essential service providers and be ready to participate fully in Governor Holcomb's reopening strategy. Congress and the administration responded with the CARES Act, and Governor Holcomb acted with a just-in-time program that aimed to keep essential childcare safely open. Our philanthropic community also engaged, particularly the Lilly Endowment with their Come Back Stronger Fund. And together, those tools were enough to help hold the floodwaters back. Every day, while working or attending school, Indiana families entrust the care and education of over 320,000 children birth to age 5 to childcare providers in over 4,000 programs. Geospatial tracking began March 21st for programs that were temporarily closing. And at the height, April 11th, Indiana saw over 2,000 childcare facilities close. When the pandemic hit, the needs for childcare didn't go away. Indiana still required thousands of Hoosiers to go to work every day to ensure that others could stay home. Workers in healthcare, safety, critical infrastructure, food supply chains were among the many heroes who took personal risks to ensure the safety of others. Without childcare, they could not do those critical jobs. Most childcare programs can only financially sustain for 2 weeks without additional support. We launched temporary assistance grants through the CARES funding allocated to CCDF, and the first payment was made to the programs on April 1st, just weeks after Indiana initial cases were identified. Over the course of the last 12 weeks, our early childhood division has supported over 2,500 providers. We also opened pop-up centers in areas of need. To date, we have spent around $55 million of our $78 million in the CARES funding. We anticipate spending all of it within the next 2.5 months. There is a significant return on investment for the use of CARES funding in this manner. Had we not given those grants, the vast majority of childcares that closed would have had to lay off people, putting them on unemployment. To open back up and stay open, childcare programs required a trusted source for COVID-19 communication. FSSA released detailed, evidence-based health guidance for childcare throughout the COVID pandemic. Along with up-to-date guidance, we had weekly provider calls and webinars. This supportive environment created the confidence and reassurance needed for many childcares to remain open while minimizing the impact of COVID. It's not enough, however, to have open programs. We also have to make sure that those who need childcare can get it. This required us to be more flexible with our policies, and I'd like to highlight a few of the changes we implemented. All appointments with CCDF eligibility offices transitioned to virtual appointments. We created a CCDF priority status for essential workers. We updated the family personal day policy so that all families received full-time vouchers and 61 additional personal days. All families received an additional 4 months of eligibility. We provided an additional 10 weeks for a total of 26 weeks to find new employment before benefits are closed. And benefits will not automatically be closed in the event that a family fails to use benefits due to illness or quarantine. The purpose of the temporary assistance grant was to retain childcare staff and ensure that supply remained. This strategy was incredibly successful. In a survey of over 1,000 providers, 65% of them indicated they had not lost staff, and 88% had adequate staff to operate. Only 19% of respondents indicated that they were forced to furlough any staff as the result of COVID-19. The investment of the CARES funding allowed for families to continue to access care, staff to continue to be paid, and small businesses to stay afloat. It's a pretty big return for relatively small investment. In addition, Indiana has been able to rapidly open many of the childcares that were forced to close. As I close, I would be remiss not to offer some possible requests as we move into recovery. There are long-term financial impacts on providers, specifically regarding the additional safety measures that we have asked them to implement. These safety measures have protected children and staff and will not be lifted for the foreseeable future. We've not been able to address the additional costs for things like PPE, cleaning supplies, or additional staff that it requires to keep children in small groups in order to minimize spread. Given that, additional funding from Congress would be extremely helpful. Our nation's long-term well-being depends on a childcare infrastructure that works for every family. This committee has a unique opportunity to help reset that future of childcare by providing funding to states to take what they've learned through this pandemic to build a more robust childcare infrastructure that can stand future disasters and create a workforce that supports large-scale economic growth. Thank you again for the opportunity to share Indiana's approach to childcare services during the COVID response. We are so grateful for the partnership, and I'm looking forward to taking questions.
Thank you, Secretary Sullivan. We appreciate your presence with us, and we appreciate your testimony. We will now question our witnesses. Without objection, each member will be recognized for 5 minutes to question our witnesses. As stated earlier, We will go in the order of seniority, switching between majority and minority members. And I will begin by recognizing myself. Ms. McChristian, I want to thank you for the risk you and your family are taking to keep our healthcare system functioning during this pandemic. As a parent, how do you balance your need to go to work and your need to have care for your daughter that does not put her or your extended family at risk?
It's not easy. It takes a bit of juggling. I have both grandparents that help out, but before we can even arrive, we have to go home, change, shower down first before we expose anyone. And then I also have a rental property, which helps supplement the income, which helps me make the choice of not going to work in order to still pay expenses or living costs. And that's how I maneuver between just family and doing everything I can to make sure I'm reducing the risk of exposing people and just not working as much to avoid being in an environment where I'm at a higher risk until I know that I can have proper health care and I'm not risking anyone in my family that is, higher risk because of their age and what other, underlying health conditions they may have.
Let me ask, what would help you the most?
Actually, what would help the most is quality childcare facilities. I understand that the workers, the wages are really hard to live off. So it's hard to maintain really quality childcare people because of the pay. I think it's important that they have just a living wage and the facility is able to provide all of the proper safety guidelines that are now being put into place as far as the hand washing station, more staff to, like I said, be with the children as far as entry, exit points, assisting them in washing their hands and just being a little bit more hands-on to just a particular group of kids as opposed to spreading all across the class, which would lead to smaller classes, and as well as I think rapid testing, because our children essentially will be with these people 8 to 10 hours a day. And I think that testing with rapid results would also help me have peace of mind that I'm leaving her and the best of care.
Well, thank you. Thank you very much. Mr. Malik, I can't help but notice that much of my district in Chicago, on the west and south sides of the city, are what you call child care deserts. Your analysis has documented this, but I do see that some poor communities do have more available child care than others. Could you explain the factors that make it more likely that enough child care options would be available in a community and how the federal government could help make that happen?
Certainly. There are unique cases that we should lift up in which there are local community-based organizations, school districts, municipalities that have invested their human capital, their connected care providers with that community. And so what we actually see in our newest child care supply and demand and our deserts work was that they're in fact a little better level of supply for neighborhoods and communities that experience high poverty, in part due to the wonderful work of Head Start program, of the targeted child care assistance that is meant to reach low-income families. You see a bit of a kind of middle-class gap, actually, in which it's those families that don't qualify for CDBG or assistance funds, but yet can't afford the high cost of childcare, so that the typical childcare desert is often a kind of middle-class neighborhood, where there's just, because of a history of chronic of our childcare system, that childcare has to be subsidized by the low wages of childcare workers, by the assistance of philanthropy and nonprofit, by the donation of space by churches and facilities that can offer low rent space. That's kind of how the system has tried to make it work for families with limited resources.
Thank you very much. Dr. Samuel, the protests in our country during the last few weeks have focused on structural inequities based on income and race and ethnicity. We know that the workers who provide child care are often poorly paid and are disproportionately women of color. Can you expand more on how these pay inequities of child care providers affect both the availability of child care for children who are younger than kindergarten age and the ability of child care workers to find care for their own children?
Yes, thank you, Chairman Davis. So according to the Early Childhood Workforce Index, on average, African-American female teachers make 84 cents for every dollar earned by their white counterparts. This is a 16% wage gap for many African-American teachers, which averages out to about $366 less per month and about $4,395 less per year. And this is just the average. We also know that Black educators just overall are likely to earn less than $15 per hour. And we know with the rising costs, that's just it's not a sustainable wage. Even those that have bachelor's degrees, the data shows that an average hourly wage is $17.86 for ages 3 through 5 and $13.83 when caring for infants and toddlers. So regardless of if you have a degree or not in the field, you're just not making a sustainable wage. And then when you couple that with the wage gap that women of color face, it only compounds the issue. I would also add that just historically, women of color have had positions of caring for others. And so it's possible to be able to care for your own child when you're not making enough on a livable wage. And I remember interacting with one particular childcare provider who loved being an early childcare teacher, but she said, passion doesn't pay the bills, and I need something that can help me pay my bills. So those are just some of the disparities that we see year after year when it comes to wages for teachers of color.
Thank you very much for your answer, and thank you for the work that you continue to do. It's now my pleasure to recognize the ranking member, Ms. Wolarski, for her inquiry.
Thanks again, Mr. Chairman. I'd like to submit for the record a March 2020 report from the National Center on Early Childhood Equality titled Addressing the Decreasing Number of Family Child Care Providers in the United States.
Without objection.
Thank you again to all of our witnesses for sharing your experiences here today. I have a couple of questions for Secretary Sullivan. In your testimony, you said Indiana deemed child care an essential service and was able to keep some providers open to serve essential workers. Did the state receive any waivers or additional flexibility from the administration or HHS to help make sure providers could still operate?
Thank you for the question. We have been so lucky with the flexibility that comes with the child care block grant and utilized all of those flexibilities to make sure that we were able to allow children to continue to access child care services. As you heard early in my testimony, we went virtual very early as an agency and made sure that there was ongoing eligibility assessment that was uninterrupted despite the response. We created an additional priority status for essential workers. Our current 3 priority statuses pre-pandemic were in partnership with our Department of Child Services for foster families, for caregivers that participate in the program, and for caregivers that participate in the SNAP program. And so this created another eligibility category that allowed those essential workers to access and immediately enter CCDF. We also granted a great degree of flexibility for families to take increased personal days so that if they weren't actively working, they would still be able to keep their vouchers so that when they did go back to work, they wouldn't have a gap in services. Additionally, we didn't ask families, we asked childcare providers to be eligible for our temporary assistance grants to not charge families to hold spots. So that was a pre-existing requirement to be eligible for the grant so that families wouldn't have to pay for childcare that they weren't using and having an additional financial burden on those families.
So every family is unique, so it's important to make sure we preserve different childcare options for parents. Can you comment on how the state has worked to include family childcare in quality improvement initiatives and other efforts to support access for families?
This is a really interesting question. We know nationally that the number of family childcares are dropping, and in some states, it's actually dropped by as much as 20% over the past 5 years. We've been asked to look at this on multiple occasions, and in Indiana, that actually is not the case. We continue to see a stable number of childcare homes as part of the services that are provided in Indiana. And we, one of the conclusions that we've drawn from that is that we don't include, many states don't include family homes in their quality rating and improvement system, and also don't allow them to participate in their pre-K programs. And don't fund them the same as they would for a center. We do. So we include our childcare network in its sum total. We include them as they're able to participate in our On My Way pre-K program and also are part of our Paths to Quality initiative. So they can be designated on that level of high quality childcares and be ranked in that space. And so we think that we have a best practice here to make sure, again, that we really support a network. We have a long way to go, but we've made really substantial progress over the last 5 years of enhancing those services and providing development and technical assistance for the entire spectrum of providers.
And then finally, what can we do at the federal level to support and grow family child care providers so they're both high quality early learning settings for children and they're sustainable businesses as well? What's the best thing we could do to help?
We need to start thinking about childcare the way that we think about any sustainable network. This has to be something that can last for more than 2 weeks at a time. One of our biggest points of learning is that the assistance that we need to develop this as not just a safe place for kids to go, but a place for them to learn and to be healthy and then to be a business is really our goal. And so establishing childcare as not daycare, but really early childhood education and the maturity that comes along with a networked system that has sustainable funding, that's flexible, that can respond to pandemics and not just natural disasters is really really a short-term goal. It shouldn't be in the distant future for us.
I so much appreciate your testimony. Thanks so much, Mr. Chairman. I yield back. Thank you.
Thank you, Representative Wolarski. And now it's my pleasure to recognize for 5 minutes, Representative Sewell.
Thank you so much, Chairman Davis. And I want to thank all of our panelists today. I'm especially excited to be joined by Dr. Samuels, since she's a graduate of Tuskegee University in Alabama. In my district of Alabama, access to quality and affordable childcare is difficult to find even in the best of times. The coronavirus pandemic has exacerbated this challenge, as our panelists have so eloquently spoken about. And it has also exposed the structural inequities that exist for underserved and rural communities of color. We know that COVID has disproportionately impacted the health and financial security of Black families. Black people are more likely to become infected, to die from the virus, and so often we have been deemed essential workers in jobs that place them at higher exposure to COVID-19. Too often, we also have been presented with the false choice between health, public health, and a strong economic recovery. Both in reality, we cannot have one without the other. We know that healthy economies are built on healthy people, and access to affordable and safe childcare will be critical to supporting families in my district of Alabama and across this country. Dr. Samuels, you have spoken eloquently about the inequities, the racial inequities in childcare, both in pay equity. But I'd also like for you to talk a little bit about how COVID-19 has put a spotlight on other social determinants of health, such as transportation, lack thereof, as well as the reality that so many of our children are having to learn by the internet. And there are obviously structural inequities when it comes to broadband as well. I'm quite concerned that our children are getting further and further behind. You've authored, Dr. Samuel, several articles about the underlying conditions that COVID-19 has put a spotlight on, and was wondering if you could talk to us about whether we should be concerned that our children are being left behind educationally through this pandemic as well. Can you please talk to us about that?
Yes, thank you so much, Congresswoman. So I will say one of the things is with COVID, we've seen the inequities across systems, from health to transportation to education, which really highlights that these are long-seated, deep structural racial inequities. And I absolutely have concerns about the potential learning loss, not just for our youngest kids, but also for kids that are in the K-12 education system and beyond. At NWEA, we actually recently launched some research that highlights that in the K-12, we're anticipating about 70% learning loss in the area of reading. And in math, kids could lose anywhere between 50% to 1 full year's worth of instruction during this time of COVID loss and the COVID learning loss. And there's absolutely things that can be done at the federal level. One, as we think about access to childcare, but also for our older kids, thinking about access to technology and broadband, because the reality is right now the instructional delivery is virtual. And if kids don't have access to either high quality teachers, the appropriate technology, or Wi-Fi or broadband, they are going to be left behind. In addition, it's so important now more than ever to make sure that parents are getting the family support that they need. I'm fortunate that as a former principal, we do homeschool here at home, which the kids don't necessarily like, but we're doing it anyway. But making sure parents have the right tools so that they can still keep up with academics at home. And I understand in the early childhood years, it looks very different. But how to encourage parents to sing with their child, read with their child. If they're cooking, they can use components of cooking to encourage math and counting. So how they can use day-to-day tips to be able to encourage that instructional and learning that can happen in the home. I also think considering home visitation. We know that home visitors play a critical support in the early childhood years, and there are many programs such as Parents as Teachers that are delivering home visits virtually so that they can support parents and have that conversation with parents on, here are tactical things that you can do based off of developmentally appropriate practice and what's available in the home.
Well, thank you, Dr. Samuels. I want to thank all of our panelists for their testimony today. I also, Mr. Chairman, want to encourage us to not just look at access to childcare, but also do a deep dive on developmental learning that has been lost during the COVID-19 pandemic as well. Thank you all.
Thank you, Representative Sewell. Gentlelady's time has expired, and the chair now recognizes Dr. Winstrup for 5 minutes. Dr. Winstrup, you may need to unmute.
My bad. Thank you very much for for recognizing Mr. Chairman, and I thank everybody for being here today. I'm glad to have this hearing. It's really important, and it's important as this has affected communities all across America. And I want to recognize our providers, childcare providers, that in many situations adapted and used these unprecedented circumstances to continue to provide some access to care. And I want to ask at some point about states sharing information on best practices, because different states, different communities seem to be doing different things. In Ohio, we work to include child care relief in the CARES Act, where our Department of Jobs and Family Services used their CARES Act dollars to provide reopening grants to public and private child care providers. This doesn't necessarily work everywhere, but the funding can go to PPE for staff, sanitization products, and ensure facilities stay open where they've reduced the child to staff ratio. Chairman Davis, you talked about a 3-to-1 ratio in Chicago. Well, that's pretty tough to accomplish that with that type of ratio, and clearly a desert as it's referred to. But still, if we are sharing best practices, maybe one type of arrangement can work in other communities that we haven't thought about. So I do want to get back to that. But also in April, I heard from a constituent concerned about their ability to use their dependent care and health FSA dollars when they're not open. And so those dollars are use it or lose it, and they would lose it at the end of that time frame. And so I led a bipartisan letter with some Ways and Means colleagues, the Treasury, give families flexibility to roll over their dependent care FSA dollars into 2021 plan, so we don't punish families who budgeted for services that have been unavailable. And so we introduced the Bipartisan Family Savings Flexibility Act. And among other provisions, this would give employees the ability to roll over their FSA dollars. And it also would increase the dependent care FSA contribution limit from $5,000 to $10,000. Well, that of course is fine for those that have FSAs and use that for their child care. That's not a one size fits all. And but we want to give people the tools that they have to weather this storm. And, I just want to stress that what I mentioned with the FSAs, that's just one way. And that's certainly not the only way, because that's not everybody. But it could provide some assistance to those struggling with childcare needs and the dollars that go with it. So let me ask Dr. Sullivan quickly, do you believe giving families the ability to roll over their dependent care dollars into 2021 would make a significant contribution to them being able to endure this situation?
Thank you for the question. I was really struck when I reviewed this proposal at its similarities in philosophy to the Healthy Indiana Plan, which is Indiana's approach to Medicaid expansion. The Healthy Indiana Plan also allows for budgeting, except within healthcare, and allows those families to start to learn how to apply their advancement in economic mobility to the healthcare plan. And any flexibilities that we can provide for families as they work through difficult circumstances, we have found to be incredibly helpful. And I believe that this would fall in that same category.
Well, thanks. I do want to comment to one of the things behind you says this is about relationships. It's not a transaction. I'm a firm believer in that. It's great with federal government to get involved, but we don't live in the communities of everybody that we're trying to help. And it's good when relationships are formed at a local level to really help people and understand their needs. So I appreciate that approach to things. Dr. Samuel, you touched on some things. My district has urban and rural. I'm pleased to be with Representative Sewell and Davis on the Underserved and Rural Healthcare Task Force. Hoping we can really provide some positive measures in the future for those that are struggling in those situations. As I went through my district, whether it's urban, it may be in large apartment buildings, rural, it may be someone in a single wide situation. And, I look at my son who's in kindergarten, and my wife was able to be online with his teachers and to print off homework and do those types of things that needed to be done for him to continue his education in kindergarten. Not everyone has access to that. And so I'm really concerned about that as we go into next year. But also, with the importance of increasing broadband, et cetera. So we got really federal and state cooperation that needs to take place. And, I don't know if you know who Jaime Escalante was, but you mentioned cooking. And here's a guy who was very creative in his teaching with the kids. But if you don't mind commenting on the importance of those things like you already did, but also how the federal and state and local communities can kind of work together to enhance these opportunities.
The gentleman's time has expired, but the witness could answer the question.
Thank you, Mr. Chairman. I appreciate that.
Thank you.
So, Congressman, I think I heard you. Well, the internet was slowing down, so I didn't catch all of it, but I think it was around ensuring access or just education opportunities and coordination at the federal, state, and local level. So if I understood the question correctly, I do think particularly as governors start to disseminate or have their GEARS funding plan, looking at how they're coordinating at not only at the state level, but at the local level, and then also providing the feedback as to what the gaps are still within their states. We know that the last stimulus package did offer a huge support to states, but in the months moving forward, there's still going to be needs that are identified. And the needs will vary based on community because certain communities were impacted differently. And so I think it's important to really use data now more than ever to be able to track where the gaps are and also the opportunities to really be able to target funds in a meaningful way. Because the reality is the recovery from COVID on the educational front is not going to happen in 1 year. This COVID class, whether it's a 2-year-old or a senior in high school, it is going to take time for them to make up for some of the educational losses. And so ensuring that we're continuing to monitor the learning loss and be able to provide support so that over the next 2 to 3 years, we see stability, not just in our economy and our world, but in education outcomes for all kids as well.
Thank you very much. Thank you, Dr. Winstrup.
Thank you.
Consistent with committee practice, we will now move to a 2-to-1 ratio in questioning, and I will now recognize Congresswoman Chu to inquire.
Thank you, Mr. Chair. Dr. Samuel, even before the COVID-19 crisis, many families of color who were eligible for child care were not able to access it. In fact, according to a report by the Center for Law and Social Policy, only 3% of federally eligible Asian children access child care through the Child Care Development Block Grant, or CCDBG, and the Child Care Entitlement to States. And only 6% of Latinx children were able to access child care. So I am a co-sponsor of HR 7027, the Child Care is Essential Act, which was introduced by Congressmember Rosa DeLauro, and it prioritizes making grants to child care providers who serve dual language learners, children with disabilities, children experiencing homelessness, children in foster care, children from low-income families or infants and toddlers, and also requires that materials for child care grants be provided in the most commonly spoken languages in that particular state. So, Dr. Samuel, as we look to invest more federal resources in programs like CCDBG, can you discuss how policies such as those in the Child Care is Essential Act can help to ensure that families of color are not left out of the federal child care support?
Thank you, Congresswoman. I would absolutely. I do think there's really 2 pieces of information that we can look at as from a policy perspective. One, looking at where the child care deserts are, as well as looking at high need areas based off of the census track, and really be able to channel those vouchers, the scholarships, the grants to those very targeted communities. And I will say too, I think we need to continue to put in front of us that kids are part of families, and oftentimes families aren't able to access the childcare opportunities that are in front of them because of challenges with transportation or just lack of family support. And so I think all the while increasing the investment is absolutely critical. Looking at how to target the vouchers, we also need to think about what other family supports are needed to ensure that the parents or the caregiver of that child can actually access the program once they're able to go through the process. I also think for some families, just having assistance going through the application process. A lot of families don't know how to access the supports. So again, it's really understanding that child is part of a larger family unit and how to support the family unit in accessing the appropriate services.
Thank you for that. Mr. Malik, in addition to serving on Ways and Means, I'm also a member of the Small Business Committee and chair of the Oversight Subcommittee. And we oversee the Paycheck Protection Program, which was to provide forgivable loans to small businesses so they can continue to pay their employees. However, childcare advocates argue that the program alone can't keep childcare centers afloat as providers continue to lose revenue due to extended closures and have to implement rigorous cleaning standards as well as adopt new social distancing policies. So, Mr. Malik, as someone who extensively studies childcare deserts, has the PPP program worked for childcare centers, and has it kept childcare centers operational? And why do we need more targeted federal assistance to programs such as the Child Care Development Block Grant and the Child Care Entitlement to States programs? And also, what improvements would you make to PPP to make it more user-friendly for child care centers? For instance, in the HEROES Act, we have a set-aside for employers of 10 employees or under. What other kind of improvements would you see would be needed to make it usable for childcare providers?
Thank you, Representative Chu. Yes, we've been fortunate to have some really great research and surveying that the National Association for the Education of Young Children has done, both on the threat to permanent closures, but also on the access to the PPP grants or loans, I should say. And they found that only about 1 in 4 childcare providers, I think, received those loans through PPP, and the vast majority of those were less than $150,000. And so, that has helped some, but will only cover a couple months of expenses. And as we're now seeing, this crisis has a very long tail to it. So one problem is that many childcare businesses have not been really as connected to the banking and the required access to banking and financial documentation that might be needed for those programs. We've heard anecdotally that there are concerns by providers that these, though they are loans that have additional forgiveness on them, that they are concerned that they may not be able to meet those specific requirements and have a fear that they may have to pay back those loans. And so what we need is really a dedicated stabilization fund, as is outlined in the Child Care as Essential Act, is along with a longer term investment to make this industry viable in the future. And I would recommend a set aside funds that do take into account the unique nature of this sector. And I'd be happy to continue to talk with your staff on that if you're considering that.
Thank you.
Thank you, Representative Chu. The chair now recognizes Representative Moore.
Thank you so much, Mr. Chairman, and I'm so happy that we're having this hearing. I missed a part of the discussion because of technical difficulties on our first speaker. But I did read through the testimony where he talked about the childcare deserts and pre-COVID situation. So I guess I'd like to ask you, sir, if pre-COVID we found ourselves in a situation where we were at a crisis, what indicators, research indicators have been used to sort of predict where we're at now? I noticed that we had about $3 billion allocated to the child care fund, and we need about $7 billion. At this point, can you just weigh in on what the post-COVID childcare crisis is looking like?
Absolutely, thank you for that question. As you said, in order to try to forecast what we're going to be looking for, the best we can do is look at where we were before, and the concern that those gaps that existed, those issues around access.
There might be someone who needs to mute. If so, please do so. I think that would help with the static. Now, please go right ahead.
Thank you, Chairman. And so what I did say in my opening statement is that the number one predictor of a positive access to childcare is a family's income. Childcare is primarily funded by parental fees for most programs in this country and for most families, and is responsive to that revenue, and that's not to discount the Child Care Development Block Grant and the federal funds and state matching funds that do help a lot of families access childcare. But that's where the deserts are. They are in middle income and low income communities. They're in Hispanic communities and other communities of color.
Well, thank you.
Thank you
so much. I'm going to take back my time. I do want to ask Dr. From Harvard. I want to ask her about the fact that we have, African American women, Latino women providing the service, and yet they can't afford to take their child to quality child care. To what extent do you think that this is harmful in the long way to their growth and development? I know a lot of families, upper class families have non-traditional, non-child care arrangements that they can rely on. A great grandparent, retires from Georgetown University so they can take care of their grandchildren and bump them on their knee. But to what extent are those informal arrangements available to low-income families?
So thank you, Congresswoman, for that question. So what we're seeing is there's definitely in some communities access to what we call family, friend, and neighbor care, where they have some type of family member who can assist. But that begs into the question around quality in the early learning environments. It's one thing for a child to be cared for or in the care of a grandmother, such as I was cared for by a grandmother. But because of the changing requirements, particularly in kindergarten entry, it really is important to think about how to create those rich early learning environments. And so, yes, it does absolutely impact early childhood providers who are providing care but can't access the care for their own child. And this is something that we've seen generationally. And so this conversation is going to be critically important to providing the supports so that early childhood care providers can gain the proper wages to be able to then not only have a sense of wealth and stability for their own life.
Okay, so reclaiming my time for 7 seconds, would you agree with this statement, really, that there is no argument that somehow the funds in the child care tax credit, for example, are, too much based on this being a temporary pandemic. But in fact, we're filling gaps that were already existing with the appropriations we're proposing in the HEROES Act.
I would 100% agree with that.
Thank you, Mr. Chairman. I yield back.
Thank you, Representative Moore. And now the chair recognizes Representative Estes to inquire.
Thank you, Mr. Chairman, and thank you to all of our witnesses for joining us today. The closures of child care facilities due to the coronavirus has resulted in a lot of lost revenue for the providers and added a lot of stress for working parents. Across Kansas and across the United States, child care facilities have had to close their doors permanently. And these closures have had community-wide impact, resulting in lost child care capacity and even more lost opportunities for workforce. Our child care providers have a strong base of support from Congress and this committee. Since my time in Congress, the funding for child care and development block grants has doubled from $2.8 billion to $5.8 billion. This is in addition to new funding to expand early Head Start programs, which received more than $10 billion in funding this year. However, this funding didn't plan for the lost revenue, the new costs of personal protective equipment and cleaning supplies, and a decline in enrollment. The CARES Act has met some of these needs, as many providers have received Paycheck Protection Program loans, as well as funds from the $3.5 billion in added child care and development block grants for states. Unfortunately, several states, and including my home state of Kansas, have withheld some of this the CARES Act funding instead of dispersing those dollars efficiently so that our child care facilities can start receiving those benefits. Both Congress and states need to do more to ensure that high-quality child care is available for hardworking families who need it as America returns to work. Dr. Sullivan, thank you for highlighting some of the successful actions that has been taken in Indiana to help child care providers. However, other states are struggling to disperse some of this federal funding. What actions do you suggest that these states might take to improve that process?
Well, thank you so much for the question, Representative Estes. The issue that many states had initially is that it's a difficult process to get money quickly out the door. And I'll say that we were extremely lucky in Indiana that we had an existing partnership with Early Learning Indiana and the ability to use our application software. Otherwise, we would be in the same boat with a delay. And we already had a time and attendance system to pay with and went through that process. And though this process has been labor intensive because we do provide those grants on an every 2-week basis as childcares reopen and assess their need, because we had an existing infrastructure to do that, we were able to do it quickly. And so my suggestion would be that as we learn from this, that we become more nimble as state government to make sure that those direct payments have a quick way to get out the door and directly into the hands of the providers that need them the most.
Thank you. And looking forward to later this summer and into the fall, what guidance might be needed from the federal level to help ensure that facilities have the necessary support and structure to help reopen safely and provide the support that's so sorely needed?
So we certainly in Indiana have taken the and approach. We don't think that there has to be a dichotomy, that health and economy and growth and education are all the priorities. They don't compete with each other. They all are complementary. From a public health standpoint, local communities and states have to have the ability to test appropriately, to trace appropriately, and then to do something called supported isolation so that as individuals are at risk, have come into contact with individuals with COVID-19 or have the coronavirus themselves, they're able to go home and do that safely. Childcare is a part of that. So making sure that those spots are secured and that we continue to have the ability to do these targeted payments to keep childcare open, should we see an increased need, is really critical. We also need to make sure that those health guidances are given directly and are possible. So making sure that we balance the practical with the possible, that we have small sizes. We call them pods here in Indiana. So kids and educators move together And so rather than having to close an entire childcare if there is a case of coronavirus, we can isolate briefly that small pod and keep the rest of the childcare open and then support those individuals through that. But that requires great hygiene, really rigorous screening processes for not taking your kids to childcare if they're sick. And certainly if parents are sick, keeping their kids home as well. But it's our responsibility to help that process to make sure that that's doable from an economic standpoint.
All right. Thank you, Dr. Sullivan, and I yield back.
Thank you, Representative Estes. The chair now recognizes Representative Evans to inquire.
Thank you, Mr. Chairman. Ms. McChrist, you spoke about the fears you and your daughter's father had about sending your child back to child care. What risks are you weighing, and what specific steps would you like your daughter's child care facility to take regarding the facility in terms of concerns?
I think the biggest risk that I weigh is the risk of the healthcare personnel contracting the virus and coming to work to spread it because of inadequate testing and rapid response for the test. That's a risk that I really weigh, and I really would like it if there was some testing with rapid results that they had access to daily. And I'm sorry, what was the second part of the question?
That was you don't find.
Okay. Well, so I think that's the biggest risk right there, just the healthcare personnel being able to test with a safe, fast turnaround time to know if they could potentially spread the virus to children.
Thank you. This is to the panel. Obviously, in the CARES Act, we did something extremely positive in terms of child care. And now we have the issue about potential opening. Please talk to me why it's still critical for the federal government in terms of making this investment regarding skilled workforce, regarding child care. Along the panel, please. Hello?
Sorry, Representative Evans, you're talking about the child care workforce?
Yes, the child care workforce.
Yeah, the child care work is an extraordinary workforce of more than 90% women, disproportionately Black women, Hispanic women of color, and I believe Dr. Samuel mentioned, and someone else, often make great financial sacrifices to serve families, and help keep this system afloat, doing extraordinary work for a barely livable wage. It's far past time that we acknowledge the way that we've undervalued caregiving and women's work. I consider this far, far past time that we place value back on caregiving.
Anyone else on the panel?
Yes, Congressman, I'd like to just chime in. The reality of it is the workforce, paying attention to the early child care workforce is not just about those early childhood educators, which are critically important, but those early child care providers are not only helping to educate the future generation in the upcoming workforce, but they're also allowing parents to go back to work. So that child care provider is serving multiple benefits to our communities and our society as a whole. And so it's high time that they're not only paid appropriately because of the magnitude of what they do, but also any parent who has a kid isn't able to go to work, myself included. I have a kindergarten and a third grader. And if I can't find care for them, I'm not able to work. And so thinking about the early childhood workforce, they are great. They serve such a great purpose for our society as a whole. And it's high time that this field that is predominantly employs women of color, that they not only get the recognition and respect due, but they also get the proper compensation as well.
Thank you. Thank you, Mr. Chairman. I yield back. I yield back, Mr. Chairman.
Chair recognizes Representative Murphy for 5 minutes.
Thank you, Mr. Chairman. Thank you for convening this important discussion. I think we can all agree that COVID-19 has really illuminated the vital role of our children's child care workers and teachers. I know for my part, I'm a mother of 2 young children, and I have a newfound appreciation for their ability to educate and care for our children. But I also realize how fortunate I am. I still have a job. I'm able to telework, and a lot of parents aren't so lucky. And for too many families, balancing work and childcare has been an ongoing struggle, as we've heard in this hearing. And in Florida, childcare costs can easily add up to over $8,000 annually, which is more than a year's tuition at a Florida public university. Finding unaffordable. And consisting mostly of small businesses, has been operating on razor-thin margins for years. These were businesses that were just barely hanging on even before COVID-19. So during peak stay-at-home orders, many of these facilities were forced to close, and less than 25% of childcare facilities nationwide received a PPP loan to help keep them afloat. And as was discussed in a prior question, a lot of these facilities are fearful about taking on this loan and not meeting the criteria that would get it forgiven. And in Florida, childcare centers can now legally reopen, but most are contending with higher fixed costs, the cost of ensuring the safety and security of the children that are there, cleaning supplies, those types of things. They're also dealing with higher operational costs and lower enrollment. Costs are so high that facilities may have to close. In fact, without much needed assistance, over half of licensed child care slots in Florida are at risk of being permanently eliminated. This presents a major problem. Our country needs families to return to work as states reopen. But if childcare remains unaffordable or worse, becomes unavailable, returning to work could become impossible for a lot of families. So simply put, our country's economic recovery depends on a functional childcare sector. And I'm proud to say that I helped lead the successful effort to include a provision in the Families First Act that provided up to 10 weeks of paid family and medical leave for workers who have to stay home to care for a child because their child's school or daycare is closed. And I also helped author the bipartisan PACE Act, which modernizes 2 provisions in the federal tax code in order to make childcare more affordable. And the House passed the core of these provisions as part of the HEROES Act. I think these 2 actions are a step in the right direction, but there's so existing childcare centers in business, and to create an environment for new centers to open and to make sure that parents can afford to send their children to these centers. Mr. Malik, can you briefly outline why childcare centers are barely profitable, even though the cost of their services can be so burdensome to families?
Absolutely. Thank you, Representative Murphy. Childcare is tremendously labor-intensive, costly, and I would say an appropriately costly service to provide to families. These are some, as a parent myself, with a 4-year-old in preschool, it is costly, and I see the value of that in every dollar that I spend. And I'm fortunate to be able to afford a program near where I live. But what I think you need to think about is a bit of a reframe and a change in our mindset. And as I mentioned in my opening testimony, the United States underinvests relative to all of our peers in developed economies around childcare. It is something that allows for parents to work. It has documented long-term and short-term benefits for children, for family stability, for citizenship, and for long-term outcomes, health outcomes. And this is a public good in just the same way that we think about our educational system and the way that we should think about our health system. We invest as a public because we get the returns of public benefits.
Thank you for eloquently stating that. I agree with you. It is a public good. And with that, I yield back the remainder of the time. Thank you.
Thank you, Representative Murphy. And now the chair is pleased to acknowledge for inquiry Representative Reed for 5 minutes.
Well, thank you very much, Mr. Chairman, and thank you to all of our witnesses and all the folks paying attention to this issue of the child care crisis in America, not only existing, but also in these very difficult times associated with the coronavirus. And one thing I wanted to start with, Mr. Chairman, if I could, is we've had the pleasure of getting to know a woman in our district who has spent an entire lifetime on the issue of child care, and she is a woman by the name of Beth Starks. She's a constituent of ours, and she is the founder and executive director of the Chautauqua Lake Child Care Center and serves on our governor's Early Childhood Advisory Council, as well as the specific task force to look at child care in America today, or in New York State today. And what I'd like to do is she recently testified in front of the New York State Assembly on that task force, and I would seek unanimous consent for her testimony to be included in the record, Mr. Chairman.
Without objection.
Thank you, Mr. Chairman. And, as you can see from that testimony, as well as from the commentary today, I will just tell you, one of the concerns I've had during this crisis is in New York State, there was approximately $164 million advanced to New York State under the Child Care Development Block Grant. And only about $30 million of that has found its way to our local communities, to our local child care providers. To me, that's appalling. That's completely unacceptable. We are seeing closure rates of our child care facilities in the district in Chautauqua County, for example, where Beth hails from, 50% closures across. And I know the Bipartisan Policy Center did a survey across America. 60% of our child care facilities have closed, and many of them are unsure about their long-term viability. And so we are continuing to put pressure on Governor Cuomo to release the rest of those child care development block grant monies. We have 100 officials that have signed on a letter joining in support of that request from across the entire New York area. And we would encourage that money to flow to our local communities as soon as possible. And one of the things that I wanted to ask Dr. Sullivan is, given her experience in Indiana, and I believe even her testimony referencing the Child Care Development Block Grant area, how can we best ensure that in the next phase 4 legislation, that money that is to go to our child care facilities really does make it to our child care facilities, and we don't have a situation where only $30 million out of $164 million makes its way to our child care facilities?
Thank you so much for asking that question. Again, our experience in Indiana was and remains unique in that we targeted the entire allotment of that additional funding to go directly for funding for childcare so that they could stay afloat during a stay-at-home order. So it was very targeted and used in its entirety for a singular purpose. We were able to do that because we had the partnership at the local level and also through philanthropy to do the other things that those dollars are allocated for. So, for example, we had other sources for cleaning equipment and personal protective equipment. And so we could really have a very targeted effort. This also allowed us to blend the funding from the PPP, so that, as you has been said several times, not all childcare are eligible for that or for the forgiveness. And so this really helped us to fill in the gaps in those spaces. We think that in subsequent rounds that we've been able to really streamline the system so that those funds can get exactly where they need to go, and really should be tied to efficiencies that states are doing in order to continue to receive funding allocation.
Well, I appreciate that, Dr. Sullivan, and I look forward to pursuing that maybe a little bit offline in regards to making sure that money gets to where it needs to be, and that's to the actual facilities rather than staying in our state capital. One other issue that I wanted to put on, and I don't know, it may have been touched upon, but one of the things is I've toured childcare facilities in the last 3 weeks in particular, because I see this crisis on the horizon, is the actual physical logistical problems that childcare facilities are going to have. They're under, the 50% capacity, the social distancing rules. And one of the concerns I have is how are we going to physically overcome the challenge of those orders, especially if our schools don't reopen up, our K through 12 schools, and also if they do open up, where are the kids going to go? How and maybe Dr. Sullivan, you could provide me some guidance there. What should I tell these folks as to how to overcome that logistical barrier of physical space?
Those are incredibly challenging. In Indiana, we will be opening schools starting July 1st. And we are, thankfully, in our data demonstrates that process is safe to do, but under some very difficult circumstances. So, specifically in early childhood, it's near impossible to do social distancing. That doesn't work for a 2-year-old. And so extensive cleaning that has to be done, and really making sure that we protect those childcare providers with screening, and then supported stay at home if they need to return home if children are ill, is very important. We also need to make sure that we have a steady supply of personal protective equipment for the providers, not only so that they're protected themselves, but so that they can protect kids.
Is there any, and I don't mean to cut you off, I'm limited on time, maybe Dr. Samuel, I saw your head shaking a little bit. Do you have any, just logistically, what facilities are best practices have been identified as facilities to take this overflow situation? Can you offer any?
To be honest with you, I cannot. It's a question that we're all grappling with. I will say one example that I heard of recently, and I'm not sure if it's actually taken place, is looking at how to disperse with K-12 kids, as you mentioned, not going back, how to use those vacant school facilities to be able to expand the childcare facilities, but it would have to be the elementary buildings where the childcare providers could have access to help with the social distancing. But that is one of the major problems that we're going to face with reopening childcare.
I appreciate that. So to the whole, all the witnesses, if you have any best practices, we would love any input you have in regards to that, because that is a logistical problem I cannot figure out a solution to at this point in time. So appreciate the input. And with that, I yield back, Mr. Chairman. Thank you for putting attention on this crisis that's developing on our horizon and already is there in our day-to-day.
Thank you, Representative Reed. The chair now recognizes Representative Gomez to inquire. Representative Gomez. You may need to unmute. There you go.
Yeah, something's wrong with my AirPods, fancy headphones. Mr. Chairman, thank you so much for holding this hearing on an important issue. We know that the coronavirus has highlighted many of the challenges that working families have long faced in today's economy. We have seen that many workers lack adequate benefits and protections, and we have seen that today's economy is not structured around the needs of working families. Childcare, I agree, is a key ingredient in today's economy, especially in the era of coronavirus. That's why I have long championed paid family leave and medical leave. And in the real world, workers at all levels of income will someday need to take time away from the full-time job to care for a sick family member or newborn child. So in the coming days, I will be introducing legislation that ensures that states with forward-thinking paid family leave programs like California are not penalized. and that these programs are adequately funded during the pandemic. The availability of safe and affordable childcare has been always been a factor in the choices that families make when it comes to their ability to work, especially now. I have personally friends that live close to their family members, even though they have great paying jobs, so that they have childcare available when they need it. But let's face it, our seniors shouldn't be the only ones that provide childcare because they're in their golden years. So how do we make it? How do we address this shortage? How do we tackle this? And we all have to acknowledge that the lack of childcare and its access is different from community to community, depending on if you're an immigrant or you're not, if you're Latino, if you're not, or a minority. And that's what we see, is that it's not a level playing field. For example, Latinos and Asians, children are more likely to have a lack of childcare options in their communities, and a majority of childcare providers in Latino neighborhoods regularly have to deny children due to a lack of space. Dr. Samuels, what factors underlie this disproportionate lack of childcare options in Latino communities?
Thank you, Congressman. There's a couple of things. One, we see the childcare deserts most in communities of color. And so one of the things we have to think about are what are the family supports for those families to be able to access, as I mentioned earlier, and also understanding some of the cultural shifts that also need to occur to make childcare facilities more friendly for kids of all backgrounds. Many of our childcare providers don't speak Spanish or other languages, and in some cases that deters families from wanting to access providers because they're not culturally represented. And so I think in addition to thinking about how to access or how to create those facilities and reduce those childcare deserts, also having culturally relevant childcare facilities that honor diverse backgrounds and perspectives and also languages is really important as well.
No, those are excellent points. If you know, I represent downtown LA, the east side of LA, but it's a very diverse district with people from the Asian American community, Korean. I have the largest Korean population, and a lot of Latinos live within those communities. So it's more mixed, and you're absolutely right about the language needs. Now we're seeing it's in order to get workers back to work. One of the main reasons why people aren't going back is that the kids are off and they don't have childcare options. So I just want to kind of get a sense from Mr. Malik. Have you been seeing evidence that workers are determining if they're going to return to work or not based on their childcare needs?
Yes, thank you, Congressman Gomez. This is something that we're studying right now, in which a lot of researchers have been tracking recent surveys and current population surveys, for instance, is showing a spike in unemployment related to childcare issues. Of course, we have historically high unemployment, and for those workers to be able to return to their jobs, a necessary precondition for that return to something like normal is having some kind of childcare. Not everyone can work from home. In fact, most people cannot work from home, and some families will not actually be able to return to normal because perhaps they have underlying conditions, are immunocompromised, and have concerns about sending their children back to childcare. And so there's a diversity of a myriad of issues facing families that are going to likely lead to great instability in the childcare sector over the coming months, making it all that more important that we stabilize those programs financially now and think going forward, that this is a crisis that may be with us for many, many months to come.
Yeah, no, I really appreciate that answer. You're absolutely right. It's more complex. And I think that what we do in federal funding isn't enough. We got to do more, but also have to make sure that that parents feel safe, that the childcare facilities they got the appropriate equipment that they need to take the precautions during the coronavirus. Because I have also situations where they opened up the childcare at big institutions, but only 2 workers go back because most parents don't want to go back. Right? It's a double-edged sword, right? We need more. We need to provide the resources to protect the childcare workers, but also to make sure that they're available, especially during this time. So, with that, I yield back, Mr. Chairman.
Thank you, Representative Gomez. Chair now is pleased to recognize Representative Kildee for 5 minutes.
Thank you very much, Mr. Chairman, for holding this hearing and for allowing me to sit in and participate. It's an important subject. As you know, I'm from Flint, Michigan, and many children in my hometown of Flint throughout the water crisis were exposed to high levels of lead. Lead is a neurotoxin. It's known to pose serious risk to a child's health, including damage to the brain and the nervous system, slowed growth and development, and learning and behavioral problems. As a result, there has been a greater need for special education services in the school district of Flint. In fact, earlier this year, Dr. Mona Hanna-Atisha, the Flint pediatrician, who's really the person who brought this whole Flint crisis to light, she found in her research that 80% of Flint children will require services for language learning or intellectual disorders. Data has proven that quality early childhood education, early child development services can mitigate the impact of exposure to lead. And that's why I fought so hard to ensure that every child in Flint has access to Head Start and Early Start. So now, 6 years later, after the Flint water crisis came to light, this new crisis hits on top of this, the coronavirus pandemic. Kids in Flint now don't have access to these high quality early childhood services that we work so hard to bring because they're staying at home to protect their families, obviously, and to protect themselves. So I guess, Dr. Samuel, I would like to turn to you and just ask for you to give us some thoughts about how this crisis, using Flint, I suppose, as an example, and there are, of course, many other communities dealing with different, similar, in some ways, situations, how a crisis like this that is keeping kids who clearly would benefit from early childhood education from those services is impacting them. And if you don't mind offering some thoughts about what families in Flint and other places can do regarding child development while they're at home during the pandemic.
Thank you, Congressman. I think that this is a perfect example of how health and education are so intricately intertwined. The health and outcomes are directly tied to education. And so a couple of things. One theme that you might have noticed through all of my responses is the importance of taking care of the family and considering family supports. And I'll say family more broadly, because we have to take care of the adults who serve as the caregivers for these children. And we also need to recognize the importance of nutritionist food, access to clean water, just the health and physiological supports that have to be in place to then be able to put that child on the trajectory and pathway to success in life. I also think it's really important, to your point, to consider what those additional supports and resources are that families need, and to think about the wraparound services so that the adult caregiver is being taken care of, but the family unit as a whole is also being taken care of, which means the economic stability, having a safe home, and then you can start to address the education factors. And right now, because kids don't have access to go out for school, it is how can we bring school at home and bring those experiences at home. Parents often think that they can't educate their child, but really fundamentally, parents are their kids' first teachers. So how do we help them? How do we help parents and caregivers build their confidence so that they can have education exchanges with their kids at home? And so I think those are really, what we should consider as we think about the health and development of children right now, in particular particularly kids who have already been impacted by another pandemic to a degree.
Right. Well, thank you, Dr. Samuel. I really appreciate your perspective. And Mr. Chairman, thank you so much for holding this hearing. It's a very important subject, very important to the people that I represent. I yield back.
Thank you so much, Representative Kildee. We want to thank you for attending. We know that you've been to other hearings, and we're delighted that you were able to be with us. Chair would now like to recognize for 5 minutes Representative Snyder, another non-member of the committee, but one who's interested in this subject matter and has joined us. Representative.
Well, thank you, Mr. Chairman, and thank you for letting me participate in this hearing, and I appreciate the witnesses sharing your perspective. This has been just a wonderful opportunity to get a deeper understanding. I know full well families belonging to communities. Accessing the workforce is often a catch-22 for them. When they have kids, it's difficult to work with. You have kids at home, especially juggling the varying unpredictable work schedules that low-income individuals often face. But it's virtually impossible to afford childcare unless you're working at the same time. Finding the balance is difficult. This is true in a pandemic. It's also true when jobs are plentiful. Looking back at 2016, more than 2 million parents were estimated to have reduced their hours or left the workforce due to child care barriers. Last week, we had a subcommittee hearing on the impact of the crisis on working families, and we know this pandemic is going to impact our economy for a long time going forward. We need to make all of the necessary adjustments to make sure that the economy emerges in a way that works for everyone. I often talk about the need to make sure our post-COVID economy is robust, is innovative, but also more fair than what preceded it. I hope that, as one of the witnesses said so well last week, we invest in childcare as a public good, because we know access to childcare is going to be critical, not just for the workers, for the parents, but for our young people, as we talked about today, our young children, to get the start that they need. And in that vein, what I'd like to do, Dr. Samuel, you talked quite a bit about the need for early childhood education, the gap between this preschool and preparedness for kindergarten. And maybe just to start, I know you've touched on it a little bit, is what's going to be the impact if we go into the fall and we don't get these kids back into a constructive learning environment? How far set back are they going to be for kindergarten, and what will be the impact for that over the long term?
Thank you, Congressman, for the question. So I have not seen data specifically, well, as concrete as we have in the K-12 world, on what the potential learning loss is for children 5 and under. Much of the learning loss work and research that is out is tracked by kids that are in the K-12 system. But we know that there is certainly a potential for learning loss. The amount is in question. And all the while, there will be some kids who, because of lack of access or parental support, will see learning loss. We will have some kids who will do extraordinarily well during this pandemic because they have the supports in place. And so thinking about how do we prepare kids holistically for a restart, that's a tough question, and one that's difficult to project, particularly because we don't know the duration of time that we might see these interruptions. And so what I would say is now more than ever, we have to look at the reality of blended learning opportunities. And when I say blended learning opportunities is, one, thinking about the virtual supports that could be in place, and then two, thinking about when facilities do open up, how do we create a model where kids can have some kind of continuity in their educational experiences, whether a site is open or not. And so blended learning models are really going to be the reality for us, at least until we completely come on the other side of this pandemic. And so that would be the best thing that I would recommend right now, is looking at the adult and caregiver supports, also looking at how to create blended learning opportunities that can be facilitated both at home and on site once facilities reopen.
Great, thank you. And let me turn to Mr. Malik. That model, if we're looking at a model of blended learning, different different ways to make sure our young children are getting the support they need, but also that their parents are able to do the work that they need to pursue their career. What kind of investment are we talking about? How does federal funding fill the gap here?
Well, one thing that we need to be sensitive to is that there have been increases in CCDBG. Recently, there was some money in there for CARES funding, but we have very unstable state budgets, uncertain state budgets. We need to provide the guarantee to allow for planning by states, by departments such as Dr. Sullivan's, so that they can count on the resources going forward to provide the supports to families, to educators, and to the public good that is childcare, so that we're doing fundamentally as much as we can to shore things up in unprecedented time of uncertainty.
Great, thank you. I have so many more questions, but I know I'm out of time. Again, Mr. Chairman, thank you so much for letting me join you, and I yield back.
Thank you, Representative Snyder. And I thank all of the members for their questions and for attending and making this hearing a very exciting and important one. Mr. Malik, Ms. McChristian, Dr. Samuel, Secretary Sullivan, I thank all of our witnesses for joining us today. Please be advised that members have 2 weeks to submit written questions to be answered later in writing. Those questions and your answers will be made a part of the formal hearing record. And we're thanking all of our staff persons who have been so instrumental in helping put this together. This subcommittee hearing is now adjourned. Thank you all. Thank you very much.